like now we're coming to closing the session. So we're still on time, even though we started a bit late, but we managed really with the interactive discussion to do it in the allocated time for the session. It was really, really insightful for me. So before we close, as always we do, we would like to take a take-home message from each one of you as a conclusion from all the discussion and the questions, that people can understand more about your experience. The same also from Dr. Omar Farouk and also from Dr. KOLs. So as we say, always we'll start ladies first. So Dr. Jacqueline. Yeah. Voice is okay? The voice is okay? You can correct. Yeah. Stand.
Well, I would like to say that don't forget compression therapy in lipedema. I think it's a very important treatment that should address in all phases, in all types, in all grades of lipedema.
Short and sweet. So with that, we of course our host, Dr. Fabio Kawamoto.
No, I'd like to thank Sigvaris for this important topic. Everywhere we go, even in Egypt, even in Brazil, even in Europe, what he says that there are not many doctors, many health professionals interested in lipedema. So I'm very happy to hear that Sigvaris is seeing this kind of patients. And also we are entering June, which is the Worldwide Consciousness Awareness Month for lipedema. So this is a very special occasion for us to start this month of awareness during lipedema. So speak about lipedema, teach lipedema, treat your lipedema patients. It's a very, very important topic everywhere.
Thanks so much. So Dr. Bakr.
Well, I want to thank you, Sigvaris, for this invitation and for all of knowledge about lipedema and about different compression therapy lessons. And of course, thank you, Dr. Fabi, for your attendance today. You are one of my idols. I am very inspired with your work, and I am very happy to be here today for this, of course. And for the patient, I want them to consider surgery mainly for those who are with higher than stage 2 of lipedema, because surgery can really impact their life better. Thank you.
Thank you so much, Dr. Bakr. Appreciate it. Dr. Vito, would like to have a message from you toward all the vascular and the phlebotomist doctor while they're doing the assessment. More tips and tricks, how they can really do the right assessment, differentiate between the patient.
Okay. So the good thing about lipedema is that you look at a situation like this. We have vascular surgeons, we have plastic surgeons, we have physical therapists, we have dietitians, we have so many different health professionals looking at these patients that were for so many years underlooked. So congratulations, Sigvaris, again for creating this event. Now talking about the vascular part of it, what I would like you, my colleagues, vascular surgeon colleagues, to understand is that lipedema is not a disease owned by plastic surgeons or by vascular surgeons, but we should be aware of it. We should make proper diagnosis and at least start the treatment of those patients. If you're not the one who's going to solve the problem, you have to be prepared to be part of the team. And in case you don't have a team, at least to make connections and to know someone who will help you to deal with those patients. Understand the physical examination, understand how to use technology in favor of our patients, and always try to learn more, as we are all doing here, in order to bring the best treatment to our patients. Thank you.
Thank you so much, Victor. Now, Dr. Mohammed Omar Farouk. So I would like really to hear from you a take-home message to your fellow, the vascular and also the plastic surgeon, in terms of the protocol and dealing with the lipedema patient.
I would like to take this opportunity to thank you, Dr. Mahmoud Al-Ghadban, for such a great effort. I know that you are the engine behind MOH and Sigvaris, and this webinar, fantastic, was your idea, and you really have made it such a fantastic webinar all over the world. I'm proud
We're getting
of
to
what
Dr.
you are
Omar. Let
doing.
us talk about the doctors now. Everyone, just let us talk about
And
the
regarding,
audience.
regarding the audience, I have learned a lot. I have learned that lipedema is a multidisciplinary team approach. No one specialty can deal with it. And actually, after this webinar, I will create in my hospital a multidisciplinary committee that will involve all these specialty to deal with cases. So thank you very much. And this is my take-home message to all who is dealing with lipedema cases.
So thanks so
Thank
much, Omar, Dr. Carlos. So we would like to have your experience, knowledge with a message to all the physiotherapists who is dealing with lipedema from your own knowledge and experience.
I want to thank you all for this great webinar. Sigvaris, thank you for increased awareness. All lipedema patients around the world really need this awareness. For the whole professor, thank you for the information. I will just take two messages. Compression therapy is very important, as Dr. Jacqueline said, and lipedema is not a cosmetic problem, as Professor Kamoto said. It's a pathological, it's an illness, it's a disease, and who suffer it, especially women who suffer it, really suffer a lot, and they need a lot of attention. So I wish this webinar increase awareness and be like a first push for the ice ball, and awareness began more and more. Thank you.
Thanks so much, Dr. Carlos. Much appreciated. We still have so many questions and comments on the chat. We're gonna get back to you, but please, again, as we said, always follow the MOH newsletter, subscribe on our landing page to get also the opportunity to get the recording if you want to get back to the recording. So again, thanks so much also from my side to you, everyone. Really, really appreciate it for having us here, involving us in this interesting journey to combine the patients for a better outcome. I think with all your valuable comments and also the lively discussions from the audience, that really truly shows how we can really work together and bring the best from each one toward the patient. Only one specialty, only one stakeholder cannot solve it. And this is actually the point. Even from our side as industry, we cannot produce and be innovative and bring great solution without your input, your feedback. That's why we're also proud and honored to work closely with Dr. Fabio Kamamoto and developing new products, innovative, helping the patient with that. So again, as I said, thanks so much. And with that, we'll close the webinar and wishing everyone a nice day. Thanks so much.
Thank you.